Thank you for tuning in to Digital Health Live. We're here at the United Healthcare presented. They're the ones that are presenting for us here at the studio. And we've got Zubin Eapen here. He's the Chief Medical Officer of Karrimor Health. My name's Derek Mathers, and I'm going to be the host for today, getting to interview. So my first question for you is, give us a brief overview of what Karrimor Health is doing to engage patients. How do you guys serve patients that have previously heretofore been underserved?
Yeah, Derek, we're delighted to be here at CES with you. And Karrimor has been around for 25 years, and traditionally we have been both the payer and the provider. So we provide health insurance through Medicare Advantage and Medicaid, but more importantly, we've become the provider for 130,000 patients across 8 states and are growing quickly to try to meet the needs of patients where they live. We round on patients in the hospital, make sure they get the right care. We take care of them in 55 care centers across the country. And importantly, I think we're really trying to start taking care of patients in the home, and not only address their clinical needs, but everything else that really a patient needs to live well every day at home.
That's a pretty incredible number, 135,000 patients that you guys are engaging with and stuff like that. I mean, I think there's 180,000 people or so at CES 2018 this year, so it's almost like everyone here is a patient that's served by you. How do you get the message out? Are you given the communication lines and introduced to these patients, or are they seeking you guys out, and how are they finding you?
It's a little bit of both. We do sell our health insurance, but importantly, moving into the future, we really are looking to partner with payers and plans to really take care of their patients. Yeah. One of the things that we really need, I think, in this country in general is not only the health insurance, but really a judicious way of taking care of patients to keep them out of the hospital, keep costs low, and improve their overall health and outcomes. And that's exactly what Karrimor tries to do. We really try to provide good preventative medicine to take care of patients and keep them out of the hospital. And that not only means taking care of them and their heart failure and their diabetes or their lung disease, it also means providing them food if they need food, providing them transportation so they can get to and from clinic, even addressing things like senior loneliness so that we know that patients who do feel isolated can feel connected with others and improve their overall health and well-being.
And it seems that there's a lot of opportunity to all of a sudden engage elderly patients with technologies such as voice or stuff like that. Are you finding, just because this is a digital health studio, are there things that you guys are thinking about right now digitally that you see as a tremendous way to get people up and moving, especially kind of the Medicare patients as well?
Derek, I'm really glad you brought this up. I think this is a really important direction, not only for us as an organization, but for the tech industry. We really want to figure out how to connect better with patients at home. And I talked a little bit about addressing loneliness and isolation in seniors.
Yeah.
But we also need to figure out how do we make sure we know which patients are getting sicker,
right,
and how do we maintain constant connections so that they don't wait until they're so sick that they go to the emergency department. For that reason, we're looking for either voice-enabled assistance, other messaging platforms that allow us to reach out to these patients, for them to reach out to us, and for us to understand when we need to deliver care directly in the home.
Fantastic. Well, Zubin, thank you so much for your time and wonderful job on your speech this morning. And thank you guys for tuning in to Digital Health Live. We're here from the United Healthcare Studio at CES 2018. Thank you so much.